Differences between meta-analysis and meta-synthesis. Meta-analysis versus meta-synthesis. Meta-analysis is a statistical analysis that combines the results of multiple scientific studies, whereas meta-synthesis is a systematic review and integration of findings from qualitative studies and an emerging technique in medical research that can use many different methods. Meta-analysis can identify relevant research studies using a defined protocol, whereas meta-synthesis can identify gaps where further qualitative and quantitative research and systematic reviews should be undertaken. The aim of meta-analysis is to determine whether an effect exists which is positive or negative and to obtain a single summary estimate of the effect. Whereas the aim of meta-synthesis is to build theory out of primary qualitative case studies that have not been planned as part of a unified multi-site effect. Meta-analysis involves the systematic identification, evaluation, statistical synthesis, and interpretation of results from multiple studies. Whereas meta-synthesis involves a process that enables researchers to examine a phenomenon such as health care experiences or understandings of health, well-being and environmental, organizational, and individual factors that affect the implementation or effectiveness of a health care service or clinical intervention. Meta-analyses are used to increase statistical power and improve estimates of size of effect, whereas meta-syntheses are used to generate new theories or an explanatory theory of why the intervention works or not by creating a hypothesis for future testing or comparison with trial outcomes. Meta-analysis can help identify which questions have already been answered and which remain to be answered, which outcome measures or populations are most likely to yield significant results, and which variants of the planned intervention are likely to be most powerful. Whereas meta-synthesis can help to frame research questions. In meta-analysis, positivist approach is used, whereas in meta-synthesis, post-positivist approach is used. Research types in meta-analysis is deductive research, whereas research type in meta-synthesis is inductive research. Meta-analysis has an end goal of theory validation and refinement, illuminating knowledge gaps, whereas meta-synthesis has an end goal of theory building as well as identification of knowledge gaps. Inclusion criteria of meta-analysis include ability to calculate an effect size alongside specific criteria for the review which should include research quality, whereas inclusion criteria of meta-synthesis include the research questions, theory underlying the work, and clear method. Data of meta-analysis include study characteristics, quantitative results, ideally raw data, whereas data of meta-synthesis include qualitative findings inclusive of the study's context, methods, analysis, researcher position, framework, and data sources. In meta-analysis, the analysis can consist of aggregation of effect sizes, overall summary and subgroup analysis, analysis of variance. Whereas, in meta-synthesis, the analysis can consist of key findings within a context discussed through ethnography, grounded theory, case study, phenomenology, or discourse analysis. Results of meta-analysis are generalizable, representative and ideally cohesive, explaining variance through further recoding, whereas results of meta-synthesis consist of new theory, encompass common as well as abnormal phenomena, remain unfinished until applied in a new setting. Quality is a function of a review that is transparent, replicable, and based on a cohesive set of studies, whereas quality is a function of triangulation from scholars, data sources, or contexts. Good reviews have supporting evidence that go back to direct quotes from primary research, have an audit trail and are clear about their own researcher's positionality. In short, meta-analysis statistically summarize results to obtain an overall estimate of effect. Whereas, a meta-synthesis is an exploratory and inductive research designed to synthesize primary qualitative case studies for the aim of making contributions beyond those achieved in the original studies. Kindly subscribe my YouTube channel Thesis Helper. Thanks for watching.